my name's Sharon. I work for the Community Engagement Team as a Community Participation Officer, and I recently had a heart attack. The common view of a heart attack is pains in the chest, but I presented differently apparently, which mostly women can. I was told that significantly men come in holding their chest, but women can come in present to the hospital with different symptoms, and mine were across the shoulder, up the back of the neck, and down my right arm, not my left. One of the ambulance drivers told me about someone presenting that they had to take to Melbourne, and the only pain, this was a lady, the only pain that she had was in her left hand, not down her arm or in her chest or anything, and she was having a massive heart attack. So if you have any symptoms that are different, yeah, definitely go to your hospital and get it checked so they can tell pretty quickly if it's a heart attack or not.
Why do women present differently with cardiac issues? This is an interesting question. We know that women present different with chest pain and heart failure symptoms. Typically, research trials in the past have been dominated by male patients, and so the evidence and data that we've gotten in the past has been predominantly looking at men. When we've gone back to actually have a look at how women present, it's not as that typical crushing type of chest pain. Yeah, sometimes it's just shortness of breath, or they've got a chest discomfort that they can't really quite pin down with the typical type of symptom. What we generally say is if you've got any sort of chest pain that you're concerned about or shortness of breath, get checked out. What are the risk factors for women when it comes to cardiac health? So we know that they also have the same traditional risk factors that men have, but the additional risk factors that we know that they get with time is that menopause can also be a risk factor. So when they're going through that time of life, we know that there's an increased incidence of cardiac disease. So that's something else that we need to particularly look at on top of the traditional risk factors that we look for in men as well. So hypertension, hyperlipidemia, smoking. Big risk factors that we'd really be looking for is definitely family history of cardiac disease, particularly in the 4th and 5th decade of life. That's earlier than we'd expect normal sort of a natural history of coronary artery disease that we'd see compared to patients that develop that, let's say, in their 7th and 8th decade of life, which is where you kind of expect that a little bit more. The other risk factors that I'd be sort of worried about is if you've got high blood pressure, high cholesterol, type 2 diabetes, if you've got a sedentary lifestyle and an elevated BMI. The other big thing too that often gets forgotten about is depression. Depression's a big risk factor for coronary artery disease. So if you've got some of these risk factors, and you're concerned, get a heart health check.